Okay, so this is the first of a few introductory movies to kind of tell you how to use the simulator. Um, I'm going to tell you how I do it and how, you can take that for what it's worth. You can do it a different way or follow your instructor's um, instructions. The the way I do it is you're going to be pulling up a sample and you'll be examining it to see if it's appropriate. And then you'll also be trying to identify the recognizable pathologies, not all of them, but the common ones. The first thing I always do is look at the age and sex of the patient. This is a 61-year-old female. The status is not fasting, and the unit. Now, the unit becomes relevant the longer you work at a place. You'll know certain units are dialysis, for instance, for renal patients, and certain units, internal medicine, certain units will be, surgery. And then also the ED, which, they take all comers, and then ICU, which would be more critical patients. So the first thing I like to do is in the initial assessment is, do I have any HIL flags to look at? If I do, then I'll be clicking this button here, and if there was a flag, it'll show me a specimen, and I'll be able to either confirm or override that. Same thing for clot and QNS. If there's some result patterns that look like a clot or a QNS, and you suspect that right away, go ahead and click it, because obviously then the specimen's not going to be any good. Uh, the way it is, you'll have to spin it down, or you'll have to put it in a small pony tube or some other technique, to get the result, because these results won't be valid. Same thing with HIL. Some labs have different protocols. In cases of gross contamination, sometimes they'll reject it, sometimes they'll spin it down or do whatever. You have to just follow the protocol. There are a couple of special conditions here where we withhold the results. One is when we know that there's some kind of contamination, and the other is when there's an obvious patient ID error. And we'll take you through some of those examples, and your instructor will be able to help you with that. And then once we determine that it's a fairly good sample, we start to look at the recognizable pathology. Are there any critical values? Critical values are values that are called to the provider right away, but there's a protocol involved, so that if it has a previous result and it's critical, then it may have already been called, and then you'd not call it again. You have to follow the institution-specific protocol, but you have to notice the critical values, and they'll be flagged with a CR out here. And the same thing with AMRs, they'll be flagged. If it exceeds linearity, there'll be an AMR flag, and you'll have some specific thing to do depending on the analyte and depending on the institution. Some institutions would want you to dilute it and repeat it. Some will just sign out greater than or less than a certain value. And then to recognize the most recognizable pathology. And if there's nothing definitive, then you can just click this and you'll be finished. But in this case, let's take a look at it. So I've got a 61-year-old female not fasting. I don't know what this unit means. There's no flags. There's no reason to look at the sample. There's only one abnormal result, and that's the glucose. So I can come to a quick conclusion that this is probably diabetes, especially since they have a previous result yesterday of 190. So they're getting above that threshold where we'd call diabetes. We click it, and then we hit submit, and then we'll get the feedback here. Now, if you want to know, how the author thinks, then you can click this, and you'll get a flashcard, we call it, and it's a quick reminder of the important values. So that where we call things, and above which or below which we call things certain clinical conditions. And then so that's just meant as a review. It's not a comprehensive reference, but it's just meant as a quick review to you. Note that there are two other things on the interface here. One is the how-to, which if you're looking at this movie, then you've discovered this, because this is how you access these introductory movies. And the other thing is a small calculator that you can call up and use it to do some calculations here where you got to do ratios and see if things are 5 times the upper limit of reference or whatever. You click the next specimen and you'll get a new specimen. The little cartoon will play and you got a fresh slate. In this case, it's a similar case. But in this, so you just go through it. This is a young person who's fasting, etc., etc. Is it a good specimen? Yes, it looks good. There are no flags, no reason to look at it. And in this case, it's a probable pre-diabetes, in that it's a fasting, even though she's a young female, 21, it's a fasting sample, and you click that and go forward. So overview, and then we have some more movies on some specific instances.